Good evening, all. So today we'll discuss one of the important aspect on critical care medicine. So I can't tell it is just an educational aspect in terms of critical care medicine. It is one of the career option also, that is European Diploma in Intensive Care Medicine. So in the recent year, so this gained lots of popularity. It's not just adding an additional qualification to your existing critical care medicine degree or some sort of the specialty degree. Maybe it's anesthesia, internal medicine, or maybe like hardcore critical care medicine itself, or even with a background of some surgical branches, or maybe emergency medicine and all. So this additional qualification is fetching some sort of opportunities when it comes to work in Western countries. So previously it was very tough to enter into the like some sort of Western countries, particularly United Kingdom, into the NHS group of hospitals. So now this Edic has given one important aspect to enter into that part of the world, so that you can gain some sort of experience in terms of meeting a different kind of people, so exchanging your ideas. So basically this gained lots of popularity in the last say maybe one and a half decade, and in the last 5-6 years it become one of the add-on qualification which most of the clinicians who work in and around critical care medicine, they want to have this. So maybe like in another 1 hour we'll try to discuss in and around like what are the options for the clearing of this exam, both for part 1 and part 2, and we'll take interview with our panelist, one Dr. Amol Meshram, so who is from the background of internal medicine. Who is currently working as a consultant in the critical care medicine and consultant physician in critical care hospital in Nagpur, Maharashtra, who cleared his IDCCM and Edic part 1 and part 2 back to back, so without any problem. So then we have 2 more doctors, Dr. Bhuvneshwari Raja, so is a second year DNB in critical care medicine. So what we call it as DRNB, critical care medicine super specialty. So who cleared, so in the second year back to back, both part 1 and part 2. So and we have one more resident doctor, Dr. Akshata Rai, so who is also in the second year of DRNB critical care medicine, so who also cleared both part 1 and part 2. So within a year span, means part 1 now, and in the next month itself, so she cleared part 2. So we'll take their input in terms of preparation, in terms of what requirements we need for Edic part 1 and part 2, and basically how you can utilize the existing source in terms of improving your preparation to get a success in terms of clearing Edic part 1 and part 2. So as I told, so basically what are the benefits of clearing Edic exam? So like I told, couple of things, like entering into United Kingdom, UK, so you need a GMC registration. For that, currently the easiest way is you clear Edic part 1 and part 2, so then you are eligible to have the GMC registration. So this is being recognized to get the GMC registration since 2019, and for that you should have a Edic qualification, so after January 2015. So remember, so this is one of the easiest method to go to UK, so then compared to that of the PLAB and all. So PLAB, again, you need to concentrate too much on the MBBS topics and all. So again, you have to go back to basic and some sort of basically in and around language, English oriented exam and all. And if you clear a Edic, both part 1 and part 2, and if you enter to the GMC, you can eligible to work as a specialist registrar, a specialist in intensive care unit, so in UK. And if you have a Edic as compared to that of the PLAB, so you are going to have a senior position bit early, because so once you enter into the system, so maybe if you wish to continue there, so you can down the line opt for FRCA, or if you want to enroll for something called CESAR program, CESR, CESAR program. So 1 year, like you can thoroughly do some sort of logbook work. Basically, like you have to show them your capacity in terms of the procedure, in terms of some presentation, in terms of some publication, good clinical work and all. So then you are eligible to have a CESAR program completed for 1 year. So it is some sort of exhaustive paperwork. So then you will get a locum consultant post. So in India, Edic is having any some sort of additional benefit? Definitely yes, because with this era of competition, if you see like lots of DNB, DRNB, FNB, IDCCM, IFCCM, along with the DM critical care medicine, along with that people coming from like abroad with some sort of the base degree in internal medicine with a training in critical care medicine. So if you have a EDIC, so you are going to have some sort of leading edge when you want to work or when you want to choose the career in corporate setup. So obviously, when the competition is going to be increased, so definitely it makes some sort of add-on some increase in the weightage when you have the EDIC in your hand. So that is advantage of having a EDIC both in Indian scenario and when you plan to go to abroad and all. So one most common question which I used to get is, when will be EDIC exam conducted in a year? So remember, so we have two parts, EDIC part 1 and part 2. So both will happen in spring and that of the autumn session. If you see EDIC somewhere, EDIC part 1 somewhere which happens in April or May, like that. Again, EDIC part 2 also usually which happens in May month. So when it comes to autumn session, so EDIC part 1 happens in September and that of the EDIC part 2 in November. So remember, so registration details and the commencing of registration is going to happen much prior. So if you see the registration of autumn session, so exam is in September, that is for EDIC part 1. So registration is going to happen in May month itself, almost June, July, August. So 3 months prior only they are going to allow for like participant to have the registration and all. So when it comes to part 2, so the registration process will happen in June for the exam of autumn session in November. So this is the recent dates of 2023. So spring session is going to happen in April 4th, 2023, and EDIC part 2 spring session is going to happen on 23rd and 24th, 2023. So registration, again, EDIC part 1. So already registration process has been done. So which happened on November 17. Part 2 registration is going to open for the spring session, that is on January 16. So this is just an overview on usual schedule of the EDIC exam. So twice in a year. Okay. So another one important question. See, most of the people, they have confusion. Am I eligible for giving this EDIC part 1? So if you are eligible for EDIC part 1, obviously then only you are going to be eligible for part 2 exam and all. So what are the eligibility criteria to give EDIC part 1 exam? So remember, you should be having an MBBS degree. That is the mandatory, and after completing an internship, so they should be enrolled in or have completed a national training program of the primary specialty. So which are all the primary specialty? So those who are eligible for like EDIC part 1 exam. So those who are doing anesthesia, so internal medicine, that is general medicine, or other specialties including pulmonology, so surgical specialty, accident and emergency trauma care, like specialty, pediatrics also. Those who are having a background of pediatrics, they can give EDIC. Or in some countries, they have intensive care medicine or critical care medicine as their base primary specialty. So those are also eligible for giving an EDIC part 1 exam. So EDIC part 2 exam, so after you successfully completed the EDIC part 1, so with maximum of 3 attempts. If you take more than 3 attempts for clearing an EDIC part 1, so then you are not eligible to give the part 2. So upper limit for the limit for EDIC part 1, which makes you to eligible for part 2, is maximum of 3 attempts. So then you should have some sort of training in and around at least 2 years in the hardcore critical care medicine. So these are some of the basic eligibility criteria to give EDIC part 1 exam. Again, I'll tell you, so with the background of MBBS, means like many of the residents, they do MBBS, and their question is, they started working in intensive care unit, maybe in any of the corporate, like tertiary corporate center and all. So they used to have this question in their mind. So just doing an MBBS makes them eligible to give Edic or not? So definitely yes. Okay, so MBBS with background of ICU training of somewhere around 18 to 24 months. So this is mandatory. At least 1.5 to 2 years, they should have a training in an intensive care unit. So preferably if they have MRCM, okay, or CTCCM. So CTCCM is one of the like post MBBS course from Indian Society of Critical Care Medicine. So that is 2-year course. So if they enroll for CTCCM or if they are already with MRCP, so that makes them so straightforward eligible for giving an Edic part 1. So one thing they need a mandatory, they should have one experience letter of that 18 to 24 months before they apply for Edic part 1 and all. See, sometimes they are just an MBBS, but they don't have any MRCM, CTCCM or MRCP. So on individual basis, yes, ICM is going to have some capacity to opt them also giving an option for doing this Edic part 1 and all. So better is just write them an email, okay, so to the ESICM and confirm beforehand before applying for the Edic part 1 and all. So definitely, so post MBBS are also able to give the Edic part 1. So now move on to our panelist. Okay, so those who successfully cleared Edic part 1, so back to back without any glitches and all. So we'll take one question, one answer from Dr. Akshata. How much it cost when it comes to giving Edic in current era? Means like, what is your intake on that?
About Edic 1 and Edic 2. If you see the cost, Edic 2 is charged slightly higher than Edic 1. And if you are a ESICM member, you'll be costed a little less compared to non-member. So there'll be a difference of €200 there. And if you're a non-member, you'll be costing around €710 for part 1. And part 2, it will be €950. In terms of Indian currency, if you have to see, it's around 60 to 65,000 for part 1 exam and around 80 to 85,000 for part 2, if you're a non-member.
So it is very clear. So it is not an exam which is going to have a very less amount as an exam fees and also quite a high amount. So at least around, I can tell 60 to 80,000 you are going to spend. So even though currently it happen online, so you don't have a traveling expenditure and all, but still the cost of this exam particularly very high. So definitely your preparation has to be very target oriented. So even though many people, they think, okay, I'm working in ICU since maybe many years, so I might be able to clear it very easily. So you need some sort of structured training. So no doubt on that, because the amount which you are going to invest is not less amount kind of this one. So we'll take one question, means one input from Dr. Amul Meshram, so who is from a internal medicine background, so who is going to throw some light. So is it mandatory to take European Society of Intensive Care Medicine membership before going for Edic? So is it required criteria? So what's your thought on that?
So good evening, sir. The thing is, you don't require a mandatory membership. But the thing is, I would suggest you to take a membership because there are many benefits of it. You know, you will be charged less as when you are appearing for the exams, and mostly the most important part of it is you get access to the journals, and you get regular feeds from the ESICM, which I think it's very important when you're preparing for your exams. It is very important to read these journals. Because just books will not suffice. So this membership is though not mandatory, but I would like to suggest that one should have this membership for these benefits. So it will help you financially also a lot much.
Yeah, so it is very clear. So other than getting a discount, see currently also, I used to get regularly some information from European Society of Intensive Care Medicine regarding when they have some sort of live webinars regarding their conference, regarding some sort of crash courses, survey. So all these things we are going to get regularly when you make an ESICM membership. And so it is one of the standard body in critical care medicine. So like our Indian Society of Critical Care Medicine, a well-recognized society. So you can think of taking the registration, means membership for the ESICM, though it is mandatory, though it is not mandatory when you plan to give Edic Part 1. So that's about ESICM membership. So then we'll take answer from Dr. Bhuvana. So basically, when it comes to some sort of prerequisites before applying for Edic Part 1. So what are the prerequisites? So I told some of the prerequisites and all. So what is your take on the prerequisites before applying for Edic exam?
Yes, sir. Good evening, sir. As you already said, at least we need 12 to 24 months of training in the intensive care unit. If you are a DRNB DM student, then you can start from your second year. If you are an IDCCM student, then you can do it after IDCCM. Even post MD, DNB, MBBS also, you can do it at least with 12 to 24 months of training. And you will definitely require a bona fide letter from your HOD or the consultant from the place where you are working for your experience certification.
So that is very, very important. See, one letter so may not be always required from your head of the department or any of the consultant who is dedicatedly working in the ICU. So you need one letter saying that you are working in intensive care unit since at least 18 months minimum. So 18 months to 24 months, that is around 2 years. So minimum bare requirement is around 1 to 1.5 years. That letter you should have. So basically, those who are already working in ICU, okay, so those who are not pursuing any sort of formal training in critical care medicine, maybe it is IDCCM, IFCCM, DRNB or DM critical care medicine. So if they think so their duration of training is means like working duration is adequate, so they can opt. So whether they are post MD, DNB, MBBS, diploma of whatever the specialty I told. So but preferably if they enroll for any sort of training process, see, I always suggest it is worth taking in the second year of your DRNB or DM critical care medicine or a post IDCCM. But you feel okay, so we have a good rationalized theoretical some sort of knowledge, and you read well during your practice also. So then when you join for IDCCM, you can opt taking this Edic Part 1 exam in the beginning itself. So Dr. Akshata, so during your critical care training, so what is the optimal time to give Edic 1? So like some few points like Bhuvana has highlighted, what do you feel what is the optimal time to give Edic Part 1?
Part 1, so its optimal time is in the middle of the second year of our 3-year DRNB or DM program. Also post IDCCM or IFCCM immediately when you're prepared for your finals of IDCCM or IFCCM you can give, because you'll have enough of theory knowledge at the end of the exam. And also if you have not in any of this course, after post your MD or DNB, if you have worked in the ICU for around 1.5 years with the critical care experience, we can give this exam. Also, if a person has done his MD, DNB, post that has worked in the ICU for around 1.5 years, then has appeared for his 3-year super specialty program, even at the beginning of that program, they can attempt giving the Edic 1 exam. So this is the optimal timing.
Yeah, so you have successfully cleared Edic Part 1 with the first attempt only. So what you thought when you applied for Edic Part 1? So you felt okay at the right time because you given your Edic Part 1 during second year.
Part 1, yes, I think as you were already mentioning in most of the times that the middle of the second year was the ideal time to give the Part 1. And yes, I felt my Part 1 attempt was the ideal attempt. The optimal time was that one which I gave in the middle of the second year. It's the best attempt I felt. So yeah.
Dr. Amol, what is your take on this? Means you feel you also back to back successfully cleared Part 1, Part 2, and all. So what is your thought on this?
Sir, my story is a little bit different because these people are very young, and I'm working in an ICU. I post DNB. I did my DNB way back in 2008. So I'm 44 right now, and for last 12, 14 years, I'm having my own practice, and I'm running an ICU also. The thing is, yes, for young people, this is the ideal time. But for people like me who wanted to upgrade the knowledge, and some people like me who want to have a little more skill, or they say what I can say, a desirable position in the field, they can also do this exam at any given point of time. There is no age limit per se. So I think for a person like me, it was an excellent experience because my aim of giving an exam was different. And the thing which helped me a lot was my last 14 years of experience of working as a physician and intensivist.
Yeah, so that's why we have taken the input from, see, because like these kind of consultants, those who are working already, they are successful in their career in both like position wise and in managing the patients, and they are a couple of consultants, they are heading some of the department, they are having their own hospital and all. See, I do come across these kind of consultants, doctors who cleared the edict part 1 and part 2. So here the message is very clear. So it is your intention, so it is your preparation, and how you are going to target and how you are going to adhere to your preparation. That is very, very important. So but those who joined as a trainee in critical care medicine, so optimally it is second year. But those who are working already in the intensive care unit, so you can opt at any time. If you feel okay, you are able to formally in a protocolized way, if you are able to give some time for edict part 1 and part 2, so that is the optimal time you can consider. So there is no some sort of specified time. So when you are not a trainee, because trainee, they have restriction in terms of the working hours, in terms of their thesis work. So that's why second year beginning is some time, so they are going to have, because their thesis topic is going to be fixed already. So I feel that is the optimal time. So if they are into some sort of training process and all. So Dr. Akshata, again, like tell about an overview on Edic 1 exam pattern. So this is very, very important because many people, they have this doubt, okay, so how Edic 1 exam runs currently?
Yes, sir. I think when we start about Edic 1, first one, that is the time when a candidate will first open the ESICM website and see much details on it about the exam. So as Dr. Bhuwana has already mentioned about the prerequisites, what we should have before applying for the exam. I think she has mentioned about all the bona fide letter, you both have mentioned already. So with that, all the details, all the required prerequisites, first we need to create a profile, that is Edic profile in the website. So once we have created a profile, then we'll get a date for registration. So on the day of registration, I think this is very important because most of them get stuck during registration or during the process of registration, because you have created a profile and you're in the process of applying. During that time, the payment mode, that is where people are stuck, I have heard. So I think it's the most accepted one is a credit card. That is the payment mode most accepted by the registration, during the registration process. So with that, we register for the exam. Once registration is done, they will validate our registration, and then we'll get an invitation letter post that, which will be sent to our email. So now this invitation letter is very important because we need to show that during on the exam day as well. So we'll have an invitation letter with us soon after the registration and validation. So next is a week prior to the scheduled exam, we'll get a link. So what is this link? Now this is now during in and around COVID era, we started giving this exam from home. So this exam is conducted from home. So the invigilation should be also done online. So they have online platform, that is ProctorU. This is an online exam platform which conducts exams. So the 1 week prior to your registered exam, you will get a link on your email ID. So through this link, you will create a account in the ProctorU. So this, when after you create a link, they'll do your system check a week prior itself. So what is a system check? They'll see the requirements of the system. like is your internet connection stable, or your webcam, the speaker, microphone, all that is meeting the requirements for the exam. They'll check that. And if you don't meet that requirement, they'll again give another slot in this 1 week period, give another slot, and they'll do a recheck of the system. I think this should be considered very seriously, because you'll be stuck on the day of exam. You need to change your system, laptops, and all those things. Again, we cannot give this exam using a smartphone or a tab. It should be a laptop. So if you have passed this system check and coming to the exam day, again they'll do a proctor check where they'll take a control on the system, and they'll do the document verification. So for this verification of a document, we'll need a ID proof. Again, your ID proof, it's better to have a ID proof which has got your details in name and all that in English. I suggest passport would be the best one. And also you have to show a printed invitation letter. They'll check that as well. Now, exam pattern, you'll have around 100 MCQs, which will be for a 3-hour duration. You'll have 2 types of questions, that is A type, which is a single best answer. Then K type, you have true or false options. So if you're not sure of the answers in between this 100 MCQs, you can tag that question and then answer at the end. So this is how the part 1 exam is conducted.
So thanks, Dr. Akshata. See, it is very clear, like you need some sort of good internet connectivity, some logistics well prepared, so proctor check and its verification, and need of an ID proof. So each preparation is very, very valid and very, very important, because see, I heard one of the senior consultant who was working in intensive care unit and who applied for Edic part 1, but the problem was there was a bad connectivity problem and all. So every time you used to like log out, log in. So it is going to add to your stress of the exam, and also then like it may impact on your result and your performance. And also appropriate preparedness with the orientation of Edic part 1 pattern is very, very important. So remember, post-COVID, this Edic part 1 and part 2 started having online. So otherwise in India, we were having a center in Kolkata. So when I given Edic part 1, so there was no center available in India. So the nearest center was UAE, means Dubai. So currently in the post-COVID era, it started having like online option and all. So Edic part 2, there was no India option as a center. Used to travel to the Western countries and all. But currently both happening online. So that's why the demand is huge. So she mentioned very clearly to get started out with the application process, and the payment itself is very, very, very exhaustive, because so it will show some sort of like not processing, payment is not going to get deducted, payment will get deducted, you will not receive mail. So lots of problem, and many people will land up in not getting any slot for the Edic part 1 and all. So that's why you should be adhere. So when the date is announced on that particular day, with a good connectivity, keep ready for payment as a credit card with the international payment option should be validated in that credit card. All these things are very, very important. So this is something like from the ESICM website only. So different domains and weightage when it comes to Edic part 1. So A type and K type. So this is the distribution which you go through, which you can go through. So this is disease management, therapeutic intervention, and organ support system exams. So practical, procedure related, and patient general care, including end of life care and all. So this is just some sort of blueprint. Okay, it may not be always mandatory. You will get with the same weightage of the questions and all. So there might be some sort of overlap around 5 to 10% in terms of the weightage, but this is the blueprint of different domains and that of the weightage which is being given in the ESICM website. So how is the marking happens in Edic part 1? So very, very important. Many people will have this apprehension. So as she told clearly, Edic part 1 is a 100 MCQ exam over a period of 3 hours. So in 2/3 of the exam questions, a question stem is composed of a vignette base. Maybe they give some sort of curve, or it may be sometimes a biochemical value, or maybe some sort of an image and all. So each year approximately 60 to 70% of the questions are going to be renewed. So 25 to 30 old questions serve as an anchoring question, but nobody knows which are the old questions. That is the the challenge here. So who failed the written exam must wait at least 1 year prior to being allowed for giving a next time exam. That is for the Edic part 1. So type A questions, which have a 5 options. So one single best answer is the correct answer. Okay. So wrong or blank answer so equals to 0 point. Okay. If you answer like as a correct, you will get a 1 point there. So in the K type, so they give 4 options. Okay, true or false. So in each question, okay, whether it is a true or false, so 0.5 point for 3 out of 4 correct answers. Okay, if you answer all the 4 correct, whether it is a true to true or false to false, so then you are going to get so total 1 point. So there is no negative mark. So answer all, so wrong answer, do not subtract the total count. So these things you need to keep in mind, and you will get adequate time. So there is usually there will be no problem in time allocation for your questions, both for A type and K type and all. So may not be always you have a fixed proportion like 60 A type, 40 K type or 50-50. So that might not always happen. So it may reverse, okay, in any of the order, 40 A type or 60 K type or 60 A type, 40 K types, or maybe 50-50. So in each year, it's going to have some sort of like mixture in terms of number of A type and that of the K type. So this is an overview on the like marking system and the pattern of Edic part 1. So again, to Dr. Akshata, like how to prepare for Edic part 1. So what material, okay, so what sources to read, like this is very, very important. Because like even though when you applied with paying such a huge amount for Edic part 1, so your preparation is very, very important in a right way. So so what is your take on this? Yeah, you are muted. Yeah, Akshata. Yeah.
The preparation duration ideally should be at least for around 2 to 3 months. Because as you said already, we are investing so much on the exam. So ideal preparation would be for 3 months. And what materials? Yes, the theory knowledge definitely coming from your master class in critical care medicine, and also the MCQ, mock MCQ for Edic preparation, what you have given that as well. And in between the MCCM proper course itself will have MCQ videos. That along with that, for books, if you're considering, it is Steve Bennington. That is one book which will give us about A and K type again. Solving that will make our exam more easier. And in Steve Bennington, we have old and new edition. I think the newer edition, which is around 2014-15, that edition, if we at least go through twice, it's better. Then we have other books like Critical Care MCQ by Stephen Lovas. That's also good. And packed material. Again, here I packed material is a bit vast, but if you have time, I think better go through this packed material, at least for a few topics like polytrauma, obstetric critical care, and liver related topics. All this, I think this would be enough, sir, for definitely clearing the Edic 1 at first attempt.
Yeah. So we'll take input from Dr. Amol Mishra. So we want definitely your input, because these are the young trainees. So they have their own targets, so own way of preparation and all. We want your input on this.
So, see, the very important thing while preparing, you should understand the pattern of exam. You know, whenever you are approaching an exam, you should understand the pattern of exam. When I gave in April, I think around 25 to 30% questions for K type, the rest were A type. So this was very important. As far as preparation is concerned, how I prepared. Let me tell you, textbooks, according to me, the textbook becomes old when it is printed. So the most helpful thing for me was Dr. Harish's classes. I did very religiously. You know, I used to take out notes. I have written almost each and every slide. I've made notes of it. So this is very important. Not just listening. You have to make notes, and you go through your notes multiple times. Revision is very important. Secondly, the most important thing is you go to the pact or ACE, what they call now, the pact module. There are around 80 to 90 topics there. So they are very concise and very good. So go through it. And the most important thing is here, you should practice giving answers. You should practice how you should give exams, like mock exams of Dr. Harish were very helpful for me. You will be very surprised. I'm not lying. I finished my part one exam in just 2 hours time. It didn't take me 3 hours. I finished in 2 hours. And the thing was, Dr. Harish's lecture was so much elaborated and integrated. And the best part is he supports you by giving review articles. So these review articles are very important, where you can gain some extra points, but which I feel which is already covered in Dr. Harish's lecture. So what I feel is, go through the lectures thoroughly and just don't listen to it. Please try to make notes of it, have your own registers, and keep on repeating and reading it multiple times. So because he has covered almost everything from trials, from latest studies, and review articles. So I think few people might agree with me. I think if you have less time, you please just concentrate on his lectures and make your notes and keep on revising it. So that will help you out.
Thanks, Dr. Amul, for your great input in this aspect. So obviously, so this is something like many people used to ask regarding the preparation. Like, sir, your lectures are sufficient, or we need something extra. So many people used to ask. See, this input I got from particularly those who are working in the senior level. Okay, so even couple of consultants, they clearly told. So they just religiously followed whatever the notes they have taken from the master classes in critical care medicine. They revised, they recalled. Okay, so ultimately they were able to clear back to back part one and part two. So both. So it's not only the part one kind of this one. So just with that, they can clear, no doubt on that. So move on, like again, so we'll go back to Dr. Akshata. So like he told some important salient points how they can utilize master classes in critical care medicine in Edic 1 preparation. So what you felt being in the second year of DRNB, so what you felt, okay, so what is the best way to use, because I know you attended the master classes in the beginning prior to joining the course also, then you again attended one more time and all. So what is your take on how to utilize the master classes in critical care medicine?
Yes, so the masterclass in critical care medicine that target various high yield topics which are mostly evidence based. And so in Edic part 1, the ruling out becomes easy. Like if it's a single best answer, the ruling out becomes more easy when we know the concepts and the evidence behind it. And also in between your lectures, you keep repeating and revising the topics. So this makes us to remember without any much effort. So like I remember tricycline and all those, the ways to be used, all those things, it's like automatically we just remember it without much effort. So what I say is, if someone is subscribing for this masterclass course, if they have to start making notes and complete it before the 3 months of their Edic 1 preparation, because each class is so vast and so elaborate that it will consume, if you're making notes, it will definitely consume at least 5 to 6 hours of time. So I think if you should be done with making notes 3 months prior to the proper preparation of the Edic 1. That's how I think it helped me clear the Edic 1, sir.
Thanks, Akshata. Move on to Edic 2. So like again the same question. So we got some good information input from Dr. Mool and Akshata. So when is the optimal time for preparation of Edic part 1 and all? So Dr. Bhuwana, what do you feel? So you cleared Edic part 1. Okay. So what do you feel the ideal time to give Edic 2? Because see, many people, they have that fear. Okay. So they think they might not have optimally prepared for Edic part 2. They think, okay, we'll postpone it for one more year. Okay. So lots of they feel lots of like confusion, lots of fear is going to be there. So what is your take on this?
So if you are doing a DM program or a DRNB program, if you are having a thesis work, then I would suggest finish the thesis work and then give the Edic 2 exam. If suppose your thesis work is done, then you can definitely give it immediately after the Edic 1, because that touch should be there. I feel like you understand the concepts, you solve these MCQs, and then if you practice for the Edic 2 immediately after Edic 1, then I think the touch will be there, and that hard work which we put in Edic 1 and understanding the concepts will help in Edic 2 too. That is my take, sir.
Yeah. So, Dr. Amol, what is your take on this? Means like, suppose someone cleared Edic part 1, so ideal time, so immediately, because we need some theoretical concept. Without that, we can't answer many of the practical questions.
Absolutely. Sir, what my take is, your best shot is immediately the next attempt of your first Edic part 1. The reason being, so there is we all know there is a specific system of giving part 2, and you have already studied in a pattern of Edic in part 1. So this thing will help you immensely when you are giving your part 2 exam. See, part 2 exam is little different. They know you know the subject, what they want to know you, how you approach the case, how practical are you. So you have given your theory exam, you have prepared well, you know your subject, you know your cases well. So my take at my level of person who is already working or is a consultant, I think the best shot is just after your first part.
Yeah, so that is really correct, because as we know that suppose you kept on delaying your practical aspect and all, so again you need to read the theory as a fresh one kind of this one. So that is very difficult. Again, you need the same revision, same like a concept you have to go through again and again. So best like time is, so you try to give Edic part 2 back to back immediately after clearing the part 1. So Dr. Bhuwana, so tell about an overview on the Edic 2 exam. So this is also very, very important aspect. So it is definitely a bit different than that of our regular way of conducting exam in Indian scenario. So how it is different in Edic part 2?
Yes, sir. So Edic 1, as we already discussed, it's mostly a concept and theory based. But when we come to Edic 2, it is basically how fast we are going to answer, how our reflexes are. And overall, it is an approach to a patient and how you are going to treat a patient as like being in a position of a consultant, like that. So it basically has 2 sections. One is clinical case scenario, one is computer based section. So in clinical case scenario, they will give you 3 case scenarios. The case scenarios will be given, they will give you time to read the scenarios, like 5 to 10 minutes before starting the vignettes. They will give you time to read the scenario, and then they will give you 25 minutes time where they will have 4 to 5 vignettes based on the case scenario which they already give you, and each vignettes will have like 6 to 8 questions, and you have to be fast in answering those questions. Within 25 minutes you have to finish 4 to 5 vignettes with 6 to 8 questions on it. If suppose you don't know any answer, then you should not waste your time on thinking or prolonging answering. You should just go to the next question, so that maybe the first question might be difficult, the second question might be easy, so you may get a point on the second or third question or vignettes. So you have to be fast in answering the question. And second section would be a computer based scenario where there will be 3 sections. Like there will be ECG and curves, there will be radiology, and there will be biochemistry. So each section there will be 8 to 12 cases, and you will have only 1 minute to answer one case. So again, you should be very fast in grasping and understanding the case and responding back.
So thanks, Dr. Bhuwana. So it is very clear. So it is a well-structured program, well-structured assessment. So which had some sort of clinical case scenario and computer-based scenario. So computer-based is so basically what we have particularly for table viva, like in Indian exams and all. So ECG, curves, radiology, ABG, and that of the biochemistry. So in terms of your case scenarios, so usually one case they give to the end, means like end of life care, which should reach the entire case length for the discussion and all. So some cases may be trauma related, or maybe pregnancy complication, a complicated sepsis, so or maybe a stroke patient, GB syndrome. So my exam was with a GB syndrome, one with a MRSA, skin soft tissue infection, and one I got a stroke patient kind of this one. So these are some of the overview on Edic Part 2 exam. So can you explain a bit more on the when it comes to computer based questions, Dr. Bona?
Yes, sir. So computer-based sections, as I already told you, there are 3 sections. So the first, curves and graphs. So it's mostly whatever we know already, but we have to keep practicing things. So the most common things would be ECG, ventilator graphics, CVP curves, ICP curves, IABP, the common CRRT alarms which we see bedside in our ICU, ECMO, common scenarios, TEG ROTEM. So in all of these, we have specific numbers only. So we have to keep practicing. In radiology also, we have the CT brains. It could be CT abdomen. It could be CT chest or chest X-ray, abdominal X-ray, lung ultrasound or an abdominal ultrasound echo. And in biochemistry, mostly it is acid-base disorders, most common electrolyte abnormalities. Sometimes Addisonian crisis, refeeding syndrome could also be asked. Obstetric emergencies, coagulation abnormalities, oncological emergencies could be asked.
So basically these 3 areas. So if you don't leave any of these areas, including like she told clearly, like CRRT, TEG, ROTEM, so IABP, okay. So radiology of different organ system, including the like imaging of a trauma, so severe acute pancreatitis. So with the different varieties of like cerebrovascular accident. So biochemistry, so you can expect some sort of hyponatremia, hypernatremia. So like some biochemistry related to acute fatty liver of pregnancy. So these kind of biochemistry you can expect in Edic Part 2. So do you think like any specific preparation needed for clinical skill station? So like that is the case presentation. So what do you feel on this?
Yes, first, we should know the basic concepts. For me, it was always the master classes. So once you understand the concept, you have to start applying on the patient. So daily our bedside case presentation, we take a case and try to present it with our friends, colleagues. Daily case presentation will definitely help. And see variety of cases, not only medical cases like trauma, surgical, obstetric. Try to see all the cases in your ICU on a day-to-day basis and practice. And either you create a mock test for you in answering, or you have your friends help or a colleague's help to discuss how, like a practice mock test you have to keep doing. And it should be fast. It should be like a reflex. Like when you answer, it should be very fast, because the time limit is very defined in EDIC exam. I would say practicing multiple times is the only solution for presenting a clinical case scenario, how fast you are.
Yeah. So this is someone who is in the training period, so that is fair enough. Means like you can practice presenting the case and all. Someone who is working in a senior position, like Dr. Amol mentioned, see, for them it may not be possible to formally present a case to someone, okay, or in their busy schedule, because they are the admin there. So they have to take care of infection control policies, some meetings, okay. So it's not possible as a formal way to take a case to present to someone and all. So how you prepared this clinical skill station, particularly this case and all?
So this thing was a little tricky for me, a little difficult part. In my exam, let me tell you, there were no 3 cases. I had 4 cases in my exam. In the first one, there were 2 short cases, and one of them was a case of heart transplant, which I have never seen in my life. We don't have heart transplants in our town. The 2 short cases were there, and then 2 long cases. So, sir, historically, what Edic has seen, majority people who fail, they fail in the table vivas. They don't fail in the cases. So what I thought was the better way of learning this thing was by teaching. So I had many colleagues with me. I had my staff with me, a few of my junior doctors, even nursing staff. I started teaching them. I think the best way to understand a subject is by teaching. So at my level, a person might not find enough colleagues to say discuss a mock test, or give a rapid fire answer kind of thing. So we have to be a little innovative. You have some colleagues, they are interested in learning, teach them. I think that is the best way of learning. But the thing is, the most important aspect which I studied this exam was, in the case clinical scenarios like table viva, if you understand the pattern, they focus more on pattern recognition of a problem. So there are biochemistries there. If you understand that pattern of disease, you will pick the answer very fast. So you have to train your mind for recognizing patterns. There are books, there are excellent books. A few of them, I'll let you know which book is there. A very small book is there which will help you in understanding the pattern recognition. Secondly, in Sir's class, he has covered typical cases, like trauma. He has talked about transfusion triggers. He has talked about obstetric critical care, and he has given the name of studies also. In one of my examiner asked me, okay, do you know any study on magnesium in pregnancy? Dr. Harish has already told, he has given everything there. So while you preparing for your part 2, first important thing is you study the cases like subarachnoid hemorrhage. Everything is there in MCCM classes. So you study those things. He has covered those points very clearly, and he has mentioned what kind of complication will come at what time. So these things are very important. Make a short note of it, and these are the questions which they ask. They expect you to tell, okay, in subarachnoid hemorrhage, what will the most common complication in first 24 hours? So these are very important things. It is already given, but you need to have a place where you write it down and keep on revising and practicing. Whenever somebody tells you, okay, tell me the complication of acute liver failure, you should be like tuck 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 tuck. You should speak those complications. Somebody asks you, what will be the precipitating factors of hepatic encephalopathy. Everything is given in the lectures, but these points, they don't expect you a long sentence. Okay, sir, there will be. They want points. So be on point. Don't beat around the bush. Just keep on put answering the words, and trust me, that is the only thing which they want. And they'll just skip the slide that, and you understand. Okay, I've given the correct answers. So if the examiner tells you, okay, anything else, so you keep this thing in mind that there are still some points which you can earn. Then you start thinking. But it should be a reflex that if somebody asks me 1, 2, 3, I should say 1, 2, 3, 4, 5, 6. Fat. So this is how you can practice, especially senior fellows like me. You can practice by teaching your colleagues. That is the best way, sir, I see.
So totally agree with Dr. Amol. See, when you teach, so you are going to recall, so your memory track is going to be fine-tuned. So that is what I also believe. Otherwise, it is exhaustive, evaporating lots of material in critical care medicine. So every day new things will come. So very difficult to carry forward the knowledge and all. So best way is if you recall every day at the bedside, okay. So then I feel like you can give any exam because you are doing the things. So what you studied, so you are recalling the things every day. So then obviously it is like reading every day. So if you try to discuss, if you try to teach, so that is the important aspect. And you mentioned very clearly, so on the master classes. So I used to tell during the like master classes in critical care medicine, each slide is an MCQ. Each slide is very important because that carries its weightage. So like even if you go through any sort of the exams, your questions roam around those causes, those etiology, those studies, those concepts. So if you understand and if you make any sort of your own way of making a notes and all, so because most of the people who had a success either in their Edic part 1, part 2, or MCCM exit exam, DNB exit exam in a single attempt. So many of the people, they have taken their notes and they revise it in their own way. So that is the best option. So again, we'll take an input on this from Dr. Bhuwana. So particularly for Edic part 2, see many people, they think the master classes, okay, they help in practical managing a patient. So it's going to helpful in Edic part 1, clearing DM, DNB, IDCCM exit exam. But when it comes to Edic part 2, so many people, they ask, sir, is this masterclass will help in Edic part 2 also? Okay, so I used to tell, see, so these are the classes, these are the slides which are prepared for everyone. Okay, whether they even they are not planning to give any sort of critical care exam also, even just for upgrading their practice also, these are the classes which are going to be helpful. So particularly for part 2, so how you felt utilizing these master classes in critical care medicine?
Basically, to understand, without understanding the concept, we cannot give edict to, sir. Like to understand the basic concepts, even the toughest concepts in critical care, I felt the master classes were very helpful. Like even the tough things, like very difficult things which I could not understand reading an article, when I listened to the classes, I was able to simplify it and make a note. So, and it was all recent evidence based, like 2020 article, 2019 article, it was all recent evidence based, where I could upgrade the knowledge which I had before from the master classes as such. And the mock test for Edic 1 also, the mock test which were there, which was really helpful. Like you keep practicing, even the tougher things will be simplified and you will be very fast. So unless understanding a concept, we cannot appear for an exam. I felt master classes is mainly helped me to understand the concepts, and tough things were simplified. And when I was revising and recalling, it was really helpful to answer me fast also. Like I knew the concept, I was able to answer like that.
Yeah. So thank you, Dr. Bhuwana, on that. So Dr. Akshata, so what specific preparation you felt needed for computer-based station? Because it is a mix of all these curves, ABG, biochemistry and all. So she highlighted what subheadings, what it's going to contain and all. So do you feel anything you want to add on this area?
Yeah. So Edic 2, actually, we had to mention that it's conducted for 2 days. So this time, first day was on computer-based skill station, and the second was on the clinical scenarios, case scenarios. So this, out of the two, I think what most of them who gave Edic 2 this time found that the CBS, that is computer-based skill station, was slightly tougher than the second day, that is CCS. So I think once we have registered for Edic 2, from then on, if we start practicing these, the whatever Viva tables, like the ABGs with all the steps bedside on daily basis, and doing the ECG in a stepwise way, and looking for all the waveforms bedside, like hemodynamic waveforms or the ventilator waveforms, and chest X-ray also with all the proper approach, ABCD approach, what we follow. And I think here, so mentioned the trauma-related X-rays. One thing is about cervical spine. Usually we miss out seeing the fractures and all in cervical spine, but it is most commonly asked in this CBS station. We had a question this time. So also the CTs, which were mentioned in the last by Dr. Bhuwana, and the MRI images, TEG, CRRT, these all, we need to practice it on the bedside on a daily basis once we are registered for Edic 2. I think that will help us when the exam comes, actually will be very fluent in answering and very quickly also. So what materials, I think here, though CBS we have one ABG shown or a biochemical picture shown, but though it is just identifying based on the values given, but there will be a second question which will be based on the theory most of the times, like what is the treatment given, what is the management, that way. So I think master class of critical care medicine will have some theoretical backup with the evidence and concept to answer those theory questions, though it is more of a practical, but we'll have theory knowledge to answer those questions. And also the small book what sir was mentioning, I think this is a data interpretation in critical care medicine by B. Venkatesh. This book also helps you to know the most of the CBS questions, how the pattern is. And other books are like Oskies for Intensive Care Medicine by Peter Hersey, and Radiology for Anesthesia and Intensive Care, where we get to know about the X-rays and the images. And ECG, you can practice also using that Amal Mattu and William Brady's ECG for emergency physician. That will also give you some idea about different ECGs, what will be asked in the exam. So definitely it is more of a, like, though it is a clinically or practically how you interpret the CBS stations, but you need definitely need to have a theoretical touch for that, which you get from the master classes.
Thanks, Akshata. So to conclude, so I just want from all of the three doctors who recently cleared Edic Part 2, so different profile. So one young trainees and one a senior consultant. So is already practicing with a well-established practice in critical care medicine and general medicine background. Because see, you both are from anesthesia background. So as a final take home, so first I'll ask Dr. Akshata, what is your success mantra So what tips you want to give to our audience?
Yes, sir. I think about part one and part two, in my case, yes, it was immediately given. Once after I cleared part one, I gave part two. I felt that clearing part one was more easier. I think it will be the same for many of the others also, because part one is a kind of exam which will be exposed even before Edic. Like we appear for NEET super specialty or a NEET specialty exam. Just that online based exam where we need to mark the appropriate answers. But in case of part two, we will not be exposed to that kind of exam, because we need to answer like a Viva, online Viva, I can tell in simple. So which will require focused preparation and a strategical approach. Only then we can quickly answer and get the needed points to pass the exam. So what in my preparation, I think the mantra is mostly the foundation that was laid by the critical care master class in critical care. Even before I joined this super specialty course, and also I was in constant touch with all the topics, probably because of the bedside discussions we had in our ICU. Also, the wide variety of the cases we have exposed in our ICU, and also I was talking to the people. I got tips from them, and definitely the support from my seniors and the colleagues who helped me during this preparation process. So what I tell the audience is, it is just that stay determined and plan well about the materials you have and your timing, scheduling, read, revise, recall, and repeat. And the more you are exposed to the subject, you'll be better in clearing the exams.
Thanks, Dr. Akshata. So, Dr. Bhuwana, what is your take on final thought on the preparation and all? Unmute, yeah.
Yes, I'm there. So I'm also from the emergency background. My foundation about critical care started even before I joined as a resident from master classes. So it has been in touch continuously. I've been following up Sir's class. And for me, Edic 1, I was with full dedication. I was following Sir's classes and mock test, which was there, I was fully practicing that. I would say for me, Edic 1 success was purely out of that. But Edic 2 was a bit different. I had to practice, I had to schedule a lot and then practice repeatedly. So as Akshata said also, we have to keep revising, practicing, create that reflex of answering and think like a consultant and have a basic best foundation from the master classes. And even if you fail one time, you have to keep trying the next time. That perseverance should be there.
Thanks, Dr. Bhuwana. See, we have a 3 different profile. That's why I kept this combination, one from emergency background, Dr. Bhuwana. So Dr. Akshata is from anesthesia background. So Dr. Amul Meshram is from internal medicine background. So like when you jump into hardcore critical care medicine, so irrespective of your primary specialty, so all preparation, all understanding the concept remains the same. So Dr. Amul Meshram, as a final conclusion, so what do you want to tell to our audience and doctors who are appearing for Edic part 1 and part 2 in the near future?
Yeah, the thing is, it doesn't matter if you are young or old or whatever my age. The most important thing is consistency. It is very, very important. So for me, the last time I gave any exam was in way back in 2008. So after that, coming back to a student mode was a little difficult part for me, being a consultant for a long, long time. But I was very lucky that I came across Dr. Harish's classes. And let me tell you, I have done 2 of his sessions, because one session I was not able to, match my timings because I've been working for at least 12 to 14 hours a day. So for me, coming to a student mode was difficult, but these classes of Dr. Harish made it very easy for me, because the classes were very elaborated and with a very limited time for me to study. Those lectures were very good. Every lecture, I took at least 2 days to go through one lecture and make my notes. I made it sure that I'll make my notes because I'm an old timer. So for me, those text, these writing on a register is very important. Making notes is very important. So one thing is consistency in making your notes studying them and revising them. Number one. Number two, your sincere work in your ICU is very important. The more you work, tickle your brain cells. Whatever you read and study and whatever you discuss with Dr. Harish, you try to apply those things in your ICU. So it naturally goes inside you. It's like following an SOP. So that SOP is actually the answer which is expected by the examiner in the exam. So study, revise, make notes. That is the most important part. If you don't make notes, just keep on listening like iPod, I don't think it will give you that much of an outcome. The best part is make your notes, revise them in your own way, and work hard. Keep consistently working, understand the pattern of exam, and always remember this: our Indian candidates, all those who have failed, maximum times they have failed in the table vivas. Let it be young or a senior consultant like me, maximum of them have, they have failed in table vivas because, see, thing is, there are a number of questions and the time is very less. So you have to train yourself by, in that time constraint, you have to give the maximum answers. So many resources sir has mentioned already, like the madam has said, even I will suggest you to read Dr. Harish's notes. Bala Venkatesha is a very good book for your data analysis. Two more things I would like to suggest you. There are two websites. One is Critic IQ. It is an Australian website. The subscription is not very expensive. It will again help you in, many times we get short of images, radiological images, So this website has good images. They have eco images also, moving images, because nowadays exam they show, many times they show moving sonography, lung ultrasonography. All these things are there. Then in graphs, again, you should know your basics. There are basic lectures of graphs, of ventilator graphs and all, given by Harish sir. Other things you can prepare from something. There's a website, I'll tell you, Life in the Fast Lane. You go through that website, you will understand a lot of graphs. So if you are studying your DRNB and other things also, you go through this. And one important thing, stick to Dr. Harish's notes. If you don't have anything, just read those notes and trust me, you'll pass. And anybody has a doubt, is this class enough? At my age, at my stage, I can assure you this class is enough if you don't have any other time. So that's for sure. Trust me.
Thanks, Dr. Amol. See, I still remember over a period of 1.5 years, he might have put at least around 50-60 questions to me.
Yes, I did.
See, but I never thought you are such a senior person.
No, sir, I was in a student mode, so it is always allowed as a student.
No. First time I am like head-to-head meeting, because every time you used to put message, sir, sir, means like you used to call, sir, this is this one, sir, this is the case, sir, this is the MCQ, or some confusion and all. Because see, I do remember couple of people, see, till now master classes has crossed more than 3,500 members and all, in different mode, Edic preparation and proper master class and all. So couple of people, so I used to get regular questions on my WhatsApp.
Well, I was one of them.
Yeah, you are one, and your questions are definitely a good weightage based. Like, not like I will not tell any questions are very light questions and all, but your questions are like, okay, so you really need input on that. Means like, so a bit controversial, okay. So bit evidence is not having a very evolved, very proven base for that. So those kind of questions you used to ask. So sometimes I really tell, even if I am not able to get, I used to go through literature and I used to give a conclusion to you, kind of this. So that makes me also to work a bit more on those questions, kind of this one. So first time I am seeing.
So these I should tell these younger fellows, don't be ashamed of asking questions. If I can ask questions, you can too, because you are still students, So go ahead and ask questions to anybody and everybody. Consider yourself as a student all your life. You'll excel in any degree you want. Trust me.
Thanks, all of you. So this is some overview on the Edic Part 1 preparatory course, so which covers almost around like 100-120 topics with around 1,800 questions with a 6 mock test and all, so which people can enroll. So this is a very well running, successfully running one and only one course for critical care medicine, that is master classes in critical care medicine. So whatever your agenda, so just for improving your knowledge, Edic part 1, part 2, so this makes the base for everything. So currently we reached more than 150 topics itself. Antibiotic itself, we have around 30 classes into 35-40 minutes kind of this one. So if anyone is interested, so target. So again, see, whatever you attend the class, whatever you take, so it is your consistency, your preparation, your continuation is very, very important, as they clearly mentioned. So that's why I used to tell, some people used to ask me, sir, so it is the last month, sir, so I missed this, sir, that, sir. See, you need to be consistent. So if you are consistent in a religious way, so like at least you listen. See, many people, they utilize it in a different way. Means many people, they put audio while driving, so while going to gym, okay. So and while doing, see, I heard lots of, because many people, they met me so in different conferences, and many came to Bangalore something else, and they met me and they expressed their stories in their own way. Means how they used to listen, so how they used to take notes and all, but they were consistent. So definitely that makes one of the important thing which you can utilize for Edic part 1 and part 2 also. So thank you all. So thank you one and all. Thanks Dr. Amol Meshram for making the time, and Akshata and Dr. Bona. So with this we'll conclude. So any doubts, this is my mail ID. This is my one and only one personal number. So can put any queries related to part 1, part 2, master classes, preparation, books, or maybe MCQs, or any practical cases and all. Thank you. Good night.
Good night, sir. Good night.
Good
Thank
night.
you so much.
Good night.